Hello lovely people, welcome back to my channel. This is Abdul Malik. Please, if you have not subscribed yet, go back to the subscription button and subscribe, and then after that you share it, okay? And then once again, if you are done, then you can also hit on the notification button for a new content anytime we have them. Today we are going to look at some common areas in the respiratory system that the question banks usually ask questions on. Okay, I know you have been solving a lot of questions, so let's see how some of the information are being digested and the reason why you have them. Okay, first of all, let us look at chronic obstructive pulmonary disease. Now, you know this condition has to do with what? It's chronic. Whenever there is an obstruction of the airway continuously, okay, for a very long time, you know, it's chronic obstructive pulmonary disease, and asthma can be one of the causes. Okay, asthma can be one of the causes, and those kind of respiratory conditions that can lead to this particular problem called chronic obstructive pulmonary disease, or COPD. Remember, when it comes to those areas in the NCLEX, remember they have been using this barrel shape, okay, due to hyperinflation of the lungs. This one is as a result of what? Hyperinflation of the lungs. Remember, when it comes to chronic obstructive pulmonary disease, the patient accumulates a lot of carbon dioxide due to the fact that, okay, ventilation is impaired, and then the patient is not getting adequate oxygen. So whatever taken in, okay, it means that whatever taken in, the oxygen or the air taken in is what? Is smaller. Due to that, oxygen is not what? Is not taken, and then there might also be a problem with the lungs. So because of that, oxygen, exchange become a very critical problem in this condition. Because of that, okay, there is hypercapnia. That means that there's going to be accumulation of carbon dioxide within the system, okay, unlike oxygen. Because of this, the patient becomes used to the carbon dioxide to the extent that the minute you try to hyperperfuse the patient or giving more oxygen to the patient, there is a problem. It's just like you pouring a cold water on a hot object. There will be a reaction. There will be boiling on the surface. Okay, that is how the patient will act. So restlessness will be what? Will be increased due to the fact that the patient is used to what? Carbon dioxide in the system. Take note in COPD patient. So in the NCLEX exam, sometimes they'll tell you a patient with which of the following condition is will you follow up with the patient, for instance, or which of the following symptoms will you follow up, and then the patient tells you that, or as per assessment, there is SpO2 of what, 85% or 90%, and the other one will be like one leg swelling. When you look at these two, you realize that, okay, even though the patient is having COPD, all right, the 85% or 90% oxygen is okay with them. They're okay with it. Because remember, there is what? Hypercapnia, or increase in carbon dioxide in the system. So they're okay with it. Because of that, I would rather choose what? One leg swelling. Due to the fact that, okay, deep vein thrombosis can be the cause, and pulmonary embolism can be the result out of that. So take note. That's how the NCLEX try to question, especially when it comes to prioritizations. Remember about that. Okay, so when it comes to the COPD, when it comes to the assessment, okay, we see that it's going to be a barrel shape. It's also one of the things that can lead to emphysema. Emphysema can also cause this particular one. Okay, they are what they call two pairs. Emphysema, okay, due to hyperinflation of the lungs. So emphysema is there, or barrel shape. They normally use that one. So take note of that, barrel shape. And then there's going to be exertional dyspnea, and then hyperinflation of the lungs, and the patient will try to cough. How do you treat it when it comes to the COPD? This is NCLEX target areas we are letting you know. Okay, now remember, a tripod position is very, very important, or orthopneic position, or orthopnea position is very, very important, where the patient will sit down or sometimes lean on the table to be able to open the airway for the patient to get adequate oxygen. They are also very important points. And then take note in NCLEX, we give the oxygen through venturi or nasal prongs or nasal cannula. Don't go and hyperperfuse the patient by giving non-rebreathable mask. It is wrong. Don't give a non-rebreathable mask when it comes to this particular condition called COPD. One of the NCLEX areas, that is why we are doing those kill bank, hit our targets. Take note of that. And then we also have to encourage fluid intake. Encourage fluid intake is very, very important. And then deep breathing exercise is also very good. Remember, in this particular condition, there is a per-slip breathing due to the fact that they are trying to bring out a lot of carbon dioxide. So that a lot of carbon dioxide is brought out because of what? The prolonged expiration. Okay, these are some of the things that you can get from what? From the COPD question. So take note of that. They are very, very important. And then let us also look at this particular problem, okay, in the respiratory system, where NCLEX lovely and mostly ask questions on. Okay, PTB, pulmonary tuberculosis. Now, this is also one of the NCLEX areas in respiration that they normally bring question on. So let's see how some of the questions are like. Remember, it is an airborne condition. In the NCLEX exams, you will see that they will ask, what particular precaution will you take? Airborne, they will bring airborne contact precaution, standard precaution, and droplet precaution. Remember, it is airborne what? Precaution that will take in this particular condition called what? PTB. Take note of that. And then you need to isolate the patient. Isolate the patient. Remember, there's a likelihood of what? The patient infecting any other person. It is communicable disease. Because of it is airborne, it flows through the air. So anybody inhaling the what? The mycobacterium what? Will have this condition. Remember about that. Because of that, what do? We need to isolate the patient. And then we should nurse the patient in the negative pressure room. One of the NCLEX areas. Aside the isolation, negative pressure room is also very important. And when you look at the assessment of this particular condition called PTB, you're going to have cough, fatigue, dyspnea is going to be present, night sweat is present, and then weight loss. Remember, low-grade fever and chills are going to be present in this particular condition called PTB. And now, take note, we have some diagnostic tests that we normally do for these people. And then sometimes, if you look at the tuberculin test or the Malthus test or the tuberculin test, they are very, very important key in NCLEX, especially when it comes to PTB. Now, when you do this particular diagnosis or diagnostic test, and then it is positive, please, it's not a confirmatory tool. Take note, we use a sputum culture. Take note of this to confirm a PTB or gene expert. That is the NCLEX areas. Sputum culture or sometimes gene expert. Take note of that because you are going to what? Cough. Let the patient cough. Especially we do this early in the morning. The patient will cough. Okay, and then before the coughing, make sure the patient rinse the mouth because it is a thorough procedure we are going to do, so that you let the patient cough deeply to bring the sputum out into a container. After that, we send it to the laboratory for investigation. So take note, okay, sputum culture is very, very important. And after the patient bring out the sputum, what happens is that you need to ensure proper mouth care. Proper mouth care is very important. And one thing about NCLEX is that we take the sample before treatment. For instance, you have to take the sputum before the introduction of antibiotics. Don't give antibiotics before you take a sample. It is also wrong in NCLEX. I've seen a lot of questions coming to these areas too, so pay attention to that. Okay, and then tuberculin test. Remember, there's going to be an induration. We are going to inject a particular medication or drug, okay, under the skin, and then we leave it for about 48 to 72 hours. And then after that, we instruct the patient to come back for what? For the results. And then when you do check, remember, we use the size of the induration, the size of the area to determine. When it is less than 5 millimeter, it means that the patient is negative. Okay, but when it is more than that, it means that it is positive. But we can use that one to confirm the diagnosis. Let's use the gene expert or sputum culture to confirm it. Please take note of that. All right, they are very, very important key in NCLEX. Okay, and then one thing about it is that, remember, we need to let the patient wear a mask. Okay, the patient wear a mask in NCLEX. When it comes to this particular condition, the patient wear a mask when he or she is going for what? Is going for X-ray or any other thing, or take a scan or X-ray. The patient should wear a mask, and the nurse will also wear what? A face mask. They are all face masks in NCLEX. Take note of that. Okay, and also don't let a pregnant woman to take care of this particular patient. Remember, it is a communicable disease. Pregnant women, their immune system is also low. They are very, very key point to take note of in the NCLEX exam that you are likely to meet. And then we say that when you start the treatment, okay, remember, for up to 3 weeks. After 3 weeks, we say that the patient is less infectious. So the patient can go out, okay, the patient can go and take a fresh air. He can go to the mall, okay, by You can go to the mall to what? To also buy item for him or herself, okay, by covering the mouth. At that time, the patient is also less infectious. Take note of that, especially when you put the patient on the ethambutol, rifampin, the prednisone, and those kind of medications or anti-TB medication. Take note of that. And then we say that the treatment is for about 6 to 9 months. 6 to 9 months. But when the patient is immunocompromised, take note, when the patient is immunocompromised, that means that if the patient has low immune system, then we say that the treatment can go up to 12 months. Take note, it's one of the NCLEX areas too. And then we say that you don't need to isolate any family members when he or she is exposed. Remember, the patient was the family members were exposed to the patient illness. So when at home, you don't instruct them to isolate themselves. It's also one of the NCLEX areas when it comes to this particular condition. Okay, and then you know that rifampin is also one of the drugs that we give. Take note. Remember, the color of the secretion of the patient will change, like the urine will become the orange color. The moment your patient see it, it is a normal thing. Take note about it in rifampin given in PTB. They are also very important. The patient, you instruct the patient to cover the mouth. Okay, instruct the patient to cover the mouth when he or she is also sneezing. Take note of this NCLEX areas. All right. So now we are going to look at asthma. We are going to look at what? Asthma. You know, asthma is also one of the conditions in NCLEX that question normally comes in. Now, remember, in asthma, there is what? Obstruction. Remember, there is narrowing of the airway and then thickening, and also what? Production of thick tenacious secretion. That will tend to block the airway. So they are very important key here. Okay, because of that, the patient will have ventilation problem. Breathing will become impaired in this particular condition. Okay, now assessment will be wheezing. Take note, they normally use wheezing sound, okay, as one of the diagnostic tool, one of the assessment. Okay, the key assessment is what? It's the wheezing sound, and then prolonged exhalation, okay, prolonged expiration or exhalation. They are very important. Then crackle sound will be here, cyanosis, restlessness, diminished sounds, and also diaphoresis, especially breathing at night. Okay, sweating at night. They are also one of the key areas. Now take note of this key area too in NCLEX exams. Remember, anytime a patient is having asthma, and then during the course of treatment, the patient becomes quiet, lying down with that, okay, no chest movement, and then you realize that we are squatted and there's no sound in the chest, it means silent chest. This becomes an emergency. Quickly, you have to try to nebulize the patient, and by so doing, you need to do what? You need to call the rapid response team. After that, the healthcare provider is supposed to be noted because the airway is compromised. There is this particular problem called blocking of the airway due to the fact that the patient is having a silent chest. Take note of this. It's also one of the NCLEX areas when it comes to this area. In the question bank, you are likely to meet a lot of them. Okay, take note of that. And then when it comes to this particular condition, remember, we are going to use albuterol. Now, albuterol or bronchodilator is the first line of action of treatment when it comes to NCLEX. Please take note of that. The first line of treatment is giving a bronchodilator, albuterol, and Metarol, and those kind of tarot medications. They are very, very important. Please, we give it first before we give hydrocortisone. Take note, or prednisolone or hydrocort or corticosteroid. Take note of that. It is bronchodilator first before the steroid medication. These are the NCLEX areas. And then you instruct the patient to use a peak flow meter, because this one we use to measure, okay, the risk factors when it comes to the condition. For instance, if the patient is about to get asthma, okay, it is determined by this particular flow meter, okay, peak flow meter. You know, it is calibrated like red, yellow, green. When it is red, it means that the patient is having an asthmatic attack. Yellow means the probability of the patient having an attack, and when it is green, it means the respiratory system is okay with the patient. Please take notice of that. They are very, very important. And after that, let's also look at some of the diagnostic areas that we need to pay attention with regards to respiration. Remember, chest X-ray is one of the things that we do, okay, especially when you do the tuberculosis test, and then we need to confirm it. You can use the chest X-ray to confirm it. A pregnant woman should not be able to do X-ray unless it is critical. And that one, we can also let the pregnant woman to wear a leg shield to cover the abdominal area so that the baby will not be affected. It's also one of the key areas in NCLEX. Remember, and then remove all metallic objects due to the fact that it will then it will also alter the results of the X-ray. These are the key areas when it comes to the NCLEX areas that we are talking about. And then sometimes, there's a pleural effusion and then we need to do a thoracentesis in one of the respiratory conditions. Okay, so what we can do is that, remember, when it comes to this one, you need to position the patient in an upright with the arms and shoulders supported by a table, okay, or at bedside. Okay, they are very, very important, because remember, these people, we are going to let them sit and to be able to expand the lungs and also make a passage through of the needle through the chest into the lungs. Because of that, they are very, very key points. Okay, this thoracentesis is going to be done, and then you remember, or you can also do it like placing the client in a lying position or on the bed, okay, and toward the unaffected area with the head slightly elevated, okay, with the head side slightly elevated. You can also do that. And then when it comes to arterial blood gas in respiration, remember, okay, we do not do suction before we withdraw the sample. Please take note of that. Whenever we want to do arterial blood gas in NCLEX, there are so many questions coming there. We do not suction the patient. Remember, the more you suction the patient, okay, the more you restrict the patient from getting air. Because of that, there will be carbon dioxide in the system. Okay, so it will obstruct the air within the system, and then the patient the results will be altered. Take note of this. So these are the NCLEX areas, okay, because of the depletion of oxygen, as we mentioned about. Ladies and gentlemen, another key is that, take note, we also do bronchoscopy in most of the respiratory condition. Bronchoscopy, and after bronchoscopy, and then the patient bring out maybe a streak, sputum, a blood streak sputum. It means there's an internal bleeding. It's also one of the emergency you need to report to the healthcare provider. Thank you once again. These are some of the areas in respiratory that I would like you to know, to take notice of, because you're going to do NCLEX question. You are solving a lot of questions in the question banks, and you become across these areas. All right, so take note. This is part 1. We'll go and look at part 2. Remember, NCLEX is doable. Don't forget to subscribe and hit on the notification button, and then you share for us to go viral, so that people will get to know about things that they need to pass the NCLEX exams. Okay, please, you can also, if you want a content, okay, if you want a very good content with expectations, you can also contact us through the email, okay, on the screen, or go to below the video. You get the email there. mycreator110@gmail.com is the email. All right, have a nice day. Bye bye.